Excellent. Thank you so much for being here. I want to thank the news media for all that they're doing and covering COVID-19. I do want to just make note before we get started that reporting on a pandemic has a lot of different things that we want the media to keep in mind. We've handed out information sheets today for you guys to just have in mind as you're covering this and how you can protect yourself. We're also putting that on our coronavirus landing page. So if you're an organization that's interacting with the media, covering COVID-19 or any other topic, it's a best practice kind of a document that you can utilize. I just want to welcome everybody. We have a lot of people that are live streaming right now from the media as well as on Facebook Live for our media briefing on COVID-19 as OU Medicine. My name is Jennifer Schultz. I am the Senior Vice President of Marketing and Communications for OU Medicine. And we are going to go through a kind of a slightly different format for the media briefing today. Some of our media friends that are here today, all of them that are here today, experience some of the restrictions that we have in place to avoid unnecessary exposure to our patients. You will notice that we have hand sanitizer on the tables. You're encouraged to use it before and after our presentation. You will also note that we have implemented social distancing in place for our speakers, and your cameras are very far apart. We're in a very large room. We typically don't do media briefings in this room, but it allows for our speakers as well to have space. These are some things that you're going to hear about today that will help us stop the spread of COVID-19. We've gathered many of our experts here today to offer you facts about this pandemic. Many of these individuals need to get back to their clinics to care for their patients, and also are part of our public health group for OU Medicine that is working on practice and protocol. So we're going to get right to it. Our first speakers are here to talk about OU Medicine's enterprise-wide preparedness for COVID-19. Chuck Spicer is the President and CEO of OU Medicine, Inc., and Dr. Jason Sanders is Senior Vice President and Provost of the OU Health Sciences Center. I will ask them to come to the podium one at a time. First off, Chuck Spicer.
Good morning, and thank you for being here. I'm Chuck Spicer, President and CEO of OU Medicine. Our healthcare system is focusing on a critical challenge to our city, our state, our country, and the world. And we are confident in our ability to take up that challenge. Our health system includes OU Medical Center, the Children's Hospital, OU Medical Center Edmond, OU Physicians in Tulsa and Oklahoma City, the Stevenson Cancer Center, Harold Hamm Diabetes Center, and OU's 7 health professions colleges. Our teams have been working and are working around the clock to prepare our employees and patients to meet the needs that do arise and will arise. More importantly, we have been working proactively with state and local officials, the State Department of Health, the City County Health Department, our community hospital partners, and the Oklahoma Hospital Association to help prevent and reduce the spread of COVID-19. We have been preparing for this since we first heard about the virus several months ago. Our most important responsibility is the health and safety of our patients, staff, visitors, and students. Precautions and protocols across our healthcare system have been established to help achieve that level of protection, and hospital and university readiness teams made up of physicians, epidemiologists, public health experts, and clinical and hospital leaders have been meeting regularly to plan for ongoing preparedness and assure we are there for the challenge. Some of the specific steps we have taken include institutionalizing a stringent visitation policy for our patients, restricting vendor access, adopting strict travel guidelines for our staff, ensuring we have appropriate inventories of critical supplies and equipment to meet the needs of our patients, reviewing all non-emergent surgical cases and procedural cases, and rescheduling appropriately to protect our resources as well as protect exposure and risk to our patients and staff. We're already practicing social distancing. We're including virtual meetings for any meeting comprised of 10 or more people, implementing virtual work from home policies, altering our food service and cafeteria policies, and limiting the number of people that ride our shuttles at one time and cleaning them regularly. Additionally, we have developed a variety of tools to provide direction and assistance to our teams shared those with the Hospital Association on how we can handle COVID-19 together, because we believe our responsibility is to help stop this disease from spreading not just in our hospitals, but outside the walls of our buildings. We're offering these materials to anyone that needs them, and we'll make them available on our website, oumedicine.com/coronavirus. I'm confident in these times you have great partners to address challenges, and my great partner, one of my great partners, is Dr. Jason Sanders, who I'll hand off to talk about the specific things the OU Health Sciences Center is doing regarding COVID-19. Thank you.
Good morning. Thank you, Chuck. As we focus on eliminating the spread of COVID-19, it has been humbling and inspiring to witness the entire OU Medicine combined team rally with ideas and actions. No organization in the state of Oklahoma is more equipped to fight this virus than the combined efforts of OU Medicine, Inc. and the OU Health Sciences Center. Our healthcare and academic leadership is made up of highly talented and skilled experts, including researchers, infectious disease specialists, epidemiologists, public health officials, and medical providers in nearly every specialty, many of whom you will hear from today. We have been proactively and aggressively studying COVID-19, the coronavirus, and are here to bring you the latest information about the virus. Regarding our educational programs, the Health Sciences Center in Oklahoma City and Tulsa are adapting course formats and making temporary modifications in order to respond to the changing COVID-19 situation. Our students are receiving information from their colleges about using online resources, as well as making modifications to instruction in clinical and community formats. We are dedicated to mitigating the risk related to COVID-19 to our students and our campus community, while at the same time fulfilling our mission to the state to train health professionals and scientists. By limiting exposure and educating the public, we are committed not only to slowing, but to ending this deadly disease. Today, you will hear from some of our top experts in their fields regarding the latest COVID-19 information, including Dr. Linda Salinas, an infectious disease specialist who serves as the epidemiologist at OU Medical Center, Dr. Aaron Wendelboe, an epidemiologist with the OU Hudson College of Public Health, Dr. Dale Bratzler, OU Medicine Enterprise Chief Quality Officer, Dr. Doug Drebitz, Chief of Infectious Diseases at OU Medicine, Dr. Rodney Edwards, Chief of Maternal Fetal Medicine at the Children's Hospital, Dr. Mo Gesseroon, Chair of Pediatrics at the Children's Hospital. And finally, I want to leave two notes about our combined efforts at an academic health center. First, I want you and our listeners to know, the first to know, that we are in the final negotiations of an agreement between Dr. William Hildebrand, an OU Health Sciences researcher, and Pure MHC to identify novel targets for a therapeutic vaccine against COVID-19. We will give you more information as it becomes available. Secondly, we are also finalizing an agreement with another researcher to begin preclinical testing of another COVID-19 vaccine to help bring a vaccine to patients as quickly as possible. Thank you.
Thank you, Chuck and Dr. Sanders. Up next is Dr. Linda Salinas, OU Medical Center epidemiologist and infectious disease specialist. Dr. Salinas will be talking about the importance of preparedness in hospitals to ensure we can care for patients, as well as our temporary visitor policy. Dr. Salinas.
Good morning, and thank you for the opportunity. As Jennifer just said, I've been asked to discuss the importance of hospital preparedness and specifically the OU Medicine hospital preparedness. I'm going to combine these two because they are very much linked. Clearly, preparedness plays a vital role in controlling this pandemic. As OU Medicine, we have dedicated areas to specific patient care needs, ICU patients versus non-ICU patients, set up for all three of our hospitals. As Chuck alluded to, we have provided a toolkit which is updated sometimes twice daily with new recommendations as new information becomes available. This is an online resource for all of our providers. It discusses things such as testing. How do we order a test? What do we do for healthcare worker screening, etc.? We have daily briefings, often multiple daily briefings, with regards to the availability of supplies, especially important the personal protective equipment. We have staffing plans and staffing contingency plans. We have worked with all services because this touches everybody who touches a patient in the hospital. We work with our laboratory personnel in assuring they know how to handle and collect specimens. We worked with our environmental services, transportation services, and just to assure everybody understands our processes. The hospital and campus leaderships have multiple briefings daily as new developments come to light, and we adjust our recommendations based on this. Importantly, we have a collaborative effort going across all the hospitals in the city. It is not uncommon for me to speak at least daily with other hospital epidemiologists to assure we are messaging things and keeping ourselves aligned. Our new visitor policy was put into place about a day ago and includes one visitor for our adult facilities, so OU Edmond and OU Medical Center. And this visitor is to be 18 years of older. There are 2 visitors for our children's hospital and our women's hospital. This is certainly all in an effort to protect our patients, their families, our hospital caregivers, and an effort to mitigate the possible transmission of the virus. Thank you all.
Thank you, Dr. Salinas. Next up is Aaron Wendelboe, PhD, OU Hudson College of Public Health epidemiologist. He is going to talk about what actually is a pandemic and the trends we are now seeing regarding COVID-19.
Good morning. A pandemic is an outbreak of disease with sustained transmission in multiple countries. The decision of the World Health Organization of when it decided to declare it a pandemic was probably more dictated by public reaction rather than the pandemic reaching any size or scope. Since the turn of the century, we have experienced at least 5 pandemics. The SARS pandemic of 2003, the H1N1 influenza pandemic of 2009, the MERS pandemic of 2012, the Ebola virus pandemic of 2014, and the Zika virus pandemic of 2016. What makes this coronavirus pandemic different? It is the unique combination of being severe, but not too severe, along with being highly transmissible. This has made responding to COVID-19 a challenge. For example, in 2003, SARS, which was caused by a virus related to COVID-19, actually was more severe. It had a higher case fatality rate. But because of this, more cases were detected, and therefore we were able to track and prevent additional transmission. In contrast, the 2009 pandemic of H1N1 influenza, it turned out not to be as severe as we had ultimately had previously feared, and so it didn't end up stressing the public health or healthcare system to the extent that COVID-19 has. COVID-19, just to reiterate, it is severe, but not necessarily severe in everyone, and I'll get to some of those statistics in a minute. I realize that the primary question on everyone's mind is, how is this pandemic going to unfold in the future? Unfortunately, it's difficult to predict because it all depends on what we do today. There are two primary factors that will affect how the pandemic unfolds, and those have to do with transmission. There's known transmission and unknown sources of transmission. From the first time the U.S. saw a case of COVID-19, we were able to identify the source of transmission for every case for approximately a month. During that time, we had a slight increase in the number of cases. About 3 weeks ago, the U.S. had the first case of COVID-19 with unknown transmission, meaning that there was evidence of ongoing transmission in the community. When this happens, it makes it difficult to identify every single case in the community and therefore prevent transmission. It's because we are now in the situation of ongoing transmission in the United States, we're trying to predict what will happen in the future. And to do that, we can look at countries that started their pandemic before us. One thing that we have learned is that social distancing works. We've learned that because if you look at the response of countries like China and South Korea, they have instituted aggressive social distancing and other public health measures and have been able to bend the curve, which we'll talk about later. There are other countries that continue to have increasing doubling rates that are stressing the healthcare system. Italy and Iran are two of those countries that have continued to see increasing number of cases. Pandemics have a way of exposing countries' values. Who do we protect and who do we let be the casualties of disease? As public health professionals, we observe the time for the number of days it takes for the number of cases to double. What we're trying to do is make that doubling time be closer to 8 to 10 days rather than 2 to 3 days. There have been over 7,500 deaths worldwide and just under 100 in the U.S. There have been over 4,700 cases in the U.S. We expect about 10% of detected cases to be hospitalized. Of our cases, we would expect about 80% of all cases, we expect about 80% to be mild, 15% to be moderate, and 5% to be severe. The death rates we can expect will again depend on what we do today. Overall, 3% of detected cases may die. This will range from less than 0.1% to 15%, where increasing age increases your risk of death. For this and other reasons, we are working with everyone to prevent as many cases and deaths and slow the growth of this pandemic.
Thank you. Up next is OU Medicine's Chief Quality Officer, Dr. Dale Bratzler, who will now talk to us about the curve, what it is, why it is important to flatten the curve, and how the public plays a role in flattening the curve.
All right, thank you. Good morning, everyone. So as I was driving to work this morning, I heard this term that probably all of you have heard frequently. We need to bend the curve. What does that actually mean? So this is the epidemic curve that we've actually seen both for China and for all of the other countries in the world. And I will tell you that this slide now is out of date because as of last night when I looked at it, this orange line now exceeds the number of cases in China. The rest of the world has now seen more cases of COVID-19 than we're seeing in China at the outbreak of this particular disease. But China has finally bent the curve. They've gone from what we call exponential growth, where the number of cases is doubling very rapidly, and they've slowed the growth of the disease. So what did they do? Well, they focused on a lot of what we will call non-pharmaceutical interventions. There is no treatment for this disease. So they weren't curing people. So what did they do? They went to early detection. I'm told at the peak of the event, they were doing 15,000 tests on patients per day. They went to isolation then of those patients who tested positive. They did social distancing. They put into place travel restrictions. Plane, trains, buses were all shut down. Subways were shut down. They went to quarantine. They closed businesses, restaurants, factories. They canceled all large public events and closed their schools. There's data that shows that had they done those things 1 week earlier than they actually implemented some of that social distancing, they would have reduced the number of cases by 66%. But without it, had they not done those things, they would have seen 67 times more cases. So they certainly have really ramped up their public health efforts to bend the curve. So this is what that means visually. And I want to highlight the concept of health system capacity, because let's face it, in the United States, there are about 45,000 ICU beds. This is data from 2017. In Oklahoma, there were only about 1,250 ICU beds. And that number is probably lower now because, as you know, since 2017, hospitals in the state have closed. But that's the capacity, the number of nurses, doctors, ICU beds, hospital beds that we have to care for the population. If we don't do things like social isolation and social distancing and other things, without those protective measures, we'll see a big spike in the number of cases, and that's what happened in China. That's certainly what happened in Italy, where they've overwhelmed the healthcare services that they have in northern Italy. As Dr. Wendelboe said, what we're trying to do is stretch the length of time that the number of cases in our country and our state double. Because if we can do that, we can flatten the curve or bend the curve so that we don't have as many cases at once. We may not prevent complete transmission of this disease, but what we're trying to slow is the fact that we may overwhelm the health care system capacity to actually do that. So here's the epidemic curve for the United States as compared to Iran, Italy, South Korea. You can see that right now we're on a path that's not particularly good. As compared to Japan, Singapore, and Hong Kong, which did very aggressive testing and social distancing, which included strict quarantine, school closures, all of the other things that we've talked about before. I'd like to end my comments by just talking about what history can teach us here. And this is a slide about the Spanish flu, the flu epidemic or pandemic of 1918, which was devastating to the world. And I would simply highlight a couple of things. Think about the flu of 1918 in a similar way to COVID-19. There's no treatment and there's no immunity, which was the case in 1917 and 1918 when this flu actually spread very, very much. But this is the tale of two different cities, because when Philadelphia identified their first case on September 17th, it was almost 2 weeks before they implemented social distancing policies, versus St. Louis that implemented their policies within 2 days of identifying the first case. You can see they flattened the curve. They bent the curve, and that's what we're talking about when we're talking about slowing the distribution of this particular illness.
Thank you, Dr. Bratzler. Up next, we have Dr. Douglas Drevitz, OU Medicine's Chief of Infectious Diseases. He will expand upon the curve discussion a bit to talk about how we can all help stop the spread of COVID-19. He will also discuss what to do if you are exposed and screening versus testing.
Hello, and thank you for asking me to be here, and thank you for being here yourselves. I've been asked to discuss, or at least touch on, 3 different questions. One is, how can you help stop the spread or bend the curve? What can each of us do? Second question is, what to do if you are exposed? And the last question is, what is the difference between screening and testing? In terms of stopping the spread and bending the curve, as you saw from the previous talk by Dr. Bratzler, I think my biggest recommendation is to take social distancing seriously. This really is not a game, although you're welcome to turn it into a game if you're trying to teach your children how to do this. But this is something real, and it is something that works. Some of the things that you have already heard throughout many media outlets are practicing good personal hygiene. If you have a cough, make sure you cough into your sleeve instead of out into the open. Use a tissue and then wash your hands. Frequent hand washing is important. This is important because the virus can live for a particular period of time upon most surfaces. If you're spreading disease when you're talking and coughing to a variety of places, and then you're touching things, and then you touch your face or your nose, you are contaminating yourself and infecting yourself. On average, we touch our face about 90 times a day. So if you can also slow that down, that would be helpful. The social distancing norms are somewhat difficult to explain, and they may mean different things to different people. In general, it will be 6 feet and 30 minutes from folks. That's generally what is required to spread the disease, meaning that if you're within 6 feet with somebody for longer than 30 minutes. Now, that's not always the case, but that is generally the case, and realize that there are nuances to that. Something else you can do is develop creative ways to communicate with friends, children, and loved ones without being in their presence. So this will help with the psychological aspects of social distancing and isolation, and through this you can encourage them and yourselves. And by doing that, then we will all sort of protect one another. The next question is what to do if you are exposed. First thing to do is to remember that not all exposures are the same. There are high-risk exposures, there are low-risk exposures. Typically, a high-risk exposure would be something if you're in close proximity, meaning within 6 feet for a prolonged period of time, with someone with a known case of the disease. That will be harder and harder to establish until we can get testing going, but in general, that would be a high-risk exposure. If I am in this room and there is somebody up in the 25th row of this room who ends up having the disease, we see each other from 50 feet, wave, that is not a high-risk exposure. So you have to think about this. Not all exposures are the same. Remember also that not all exposures will necessarily result in infection, and not all infections result in symptoms and disease. There is a large cadre of folks who are infected, but who do not show symptoms of disease. So just because you're exposed, you will not necessarily get infected. If you are infected, you will not necessarily develop symptoms and disease. If you do develop symptoms, remember, right now in Oklahoma, it could be something else. We still have quite a bit of influenza circulating in the community. So if you do develop symptoms, my advice would be to get tested for influenza. It is a treatable disease. The sooner you get that treated, the sooner you will be better. If you have minimal or no symptoms, please do not rush out to get tested. This will overwhelm the limited testing capabilities, and it will just not be helpful to you or to the medical community. The advice would be to stay at home and protect those around you, stay away from others. That said, if you are at high risk for a progression or having severe disease, for example, if you're over the age of 65 and have a variety of medical, what are called comorbidities or medical conditions such as high blood pressure, heart disease, lung disease, or diabetes, and then you do need to call your provider and seek some guidance. If you are exposed and if you get sick, and then if your symptoms progress, particularly to the point of shortness of breath, that would be the trigger to seek medical attention and get seen. The last question is, what is the difference between screening and testing? Think of screening as a process by which the medical community assesses risk. We're trying to figure out, do you have a high risk of infection or a high risk exposure, or is it low risk? And so screening may likely include a detailed history of where you've been, and if you've been in direct contact with somebody who has been diagnosed with the COVID disease. Or, for example, if you have just recently returned from an area where there is a very high burden of disease, meaning higher than Oklahoma. In terms of testing, testing is when we actually look for the virus itself. Right now, the tests in Oklahoma and in most of the country are what's called a polymerase chain reaction test, where we're looking for viral genetic material. It's a swab that's inserted back into the back of the nose. It's just a little bit uncomfortable, but that's the best way to get a specimen. It's then run on a machine, and we can look and see if the virus is actually there. Caveat to that, remember that just if you test negative today doesn't mean that next week you won't become infected and then test positive. So just because you test negative once does not give you a pass for the next several months while we're going through this. This is a fundamentally different counsel than for other infectious diseases, such as hepatitis C, in which case we're measuring often the body's response to the infection by measuring antibodies, and when it is critically important for you to get tested so you can get treated. This is a different disease, we have different tests, and we have to deal with them and the answers differently. So realize that not all testing for infectious diseases is alike. So lastly, I would like to stress that we are all in this together. We can all do our part for social distancing. We can take the guidance from the national health authorities seriously. And by helping each other with perseverance and calm determination, we will get through. Thank you.
Thank you, Dr. Dravitz. Next up, we welcome Dr. Rodney Edwards, Chief of Maternal Fetal Medicine at the Children's Hospital at OU Medicine.
Good morning. I'm to talk to you about the special case of pregnant women and this virus. Unlike some other viruses, as best we know yet, there is no vertical transmission of COVID-19 from mother to fetus during the pregnancy or from mother to infant at the time of birth. Thus far, it doesn't seem like the infection is worse in pregnant women compared to other individuals. There are some viruses that are worse during pregnancy than in the non-pregnant state. Influenza is an excellent example. The reasons for that have more to do with pregnancy physiology than with the characteristics of the virus. So to be conservative, for now, we are considering pregnant women potentially at risk, not at greater risk of getting the virus, but potentially at greater risk of becoming more severely ill with the virus. We don't know that for sure. It's just something that we're trying to keep in the back of our minds when evaluating if a patient would need to go to the hospital or not, and caring for a coming pregnant patient when that occurs. You've heard about screening, both at entry into the hospitals. We also are screening patients and visitors in our 3 prenatal clinics on campus. We're limiting visitors to the hospital. We're also limiting visitors to our clinics. The approach to testing probably will change, but as Dr. Drevitt said, for now, only patients that are symptomatic are getting tested. That applies also to the pregnant population. And then obviously this is a situation that I anticipate will evolve both for the overall healthcare population and for pregnancy care specifically, and we will continue to work on the situation and evolve care as necessary. Thank you.
Thank you, Dr. Edwards. Our final speaker this morning will discuss the latest information regarding children and COVID-19. Dr. Morris Gesseroon is the Chair of Pediatrics for the Children's Hospital at OU Medicine. Welcome, Dr. Gesseroon.
Well, good morning, everyone, and thank you, Jennifer. I do have the opportunity to give a little bit of good news for the parents and families in Oklahoma, and that is that in general, children have very much milder disease than adults, and most present with minimal or no symptoms. Hospitals in China, Italy, and other states in the United States have reported very few children requiring hospitalization, and so we have every reason to believe that this will also be true in Oklahoma as well. Moderate or severe disease is rare, but slightly more common in infants, especially those under a year of age. And it also may be that children with significant pre-existing medical conditions, such as congenital heart disease, lung diseases such as asthma or cystic fibrosis, chronic kidney or liver disease, those with suppressed immune systems, such as those on cancer chemotherapy, metabolic disorders, or diabetes may be at increased risk. These children in particular should be watched closely for the development of the key symptoms of fever, cough, and particularly difficulty breathing. If this happens, parents should contact the child's healthcare provider. The other greatest concern is that although most children have minimal or no symptoms, they still are infected and can therefore spread the infection to others. There's growing evidence that spread from minimally symptomatic people, including children, exceeds that from those who are visibly ill. Therefore, it's important that efforts be made by parents to take certain actions to help reduce the chance that vulnerable people become infected from exposure to children. As you've already heard, practice social distancing. Limit direct contact with those who are at risk, such as including adults over 60, adults and children with chronic conditions such as heart disease, high blood pressure, diabetes, lung disease, and suppressed immune systems. The best bet is to stay home and practice enhanced hygiene measures. Finally, by now, everyone appreciates that during times of widespread infection, one of the most precious resources that a community must protect is its healthcare providers, who must remain available to treat the most ill. In order to prevent healthcare workers from becoming ill, many centers, including our own, are developing plans to reduce their exposure to potentially infected but not seriously ill patients who can delay care. As a consequence, in the long-term best interest of Oklahoma's families, we are evaluating how we can limit non-urgent visits to our facilities, and we're working to convert as many necessary visits as possible to be available by video telemedicine rather than in person. For patients followed here at Children's, our clinics will be in touch to best determine how to provide your children the care they need while minimizing your family's exposure to COVID-19. Thank you.
Thank you, Dr. Gesseroon. Thank you to all of our experts this morning that participated. Thank you to the media for joining us. Before we break into the Q&A session, I'd like to announce that today, OU Medicine is launching a public health awareness campaign aimed at educating the general public to help stop the spread of COVID-19. We are mobilizing many of our partners around this campaign and are ready and willing to share it, encouraging others to take the materials, co-brand them, and use them in their own organizations. It's important to know that these messages have been vetted by the Public Health, Epidemiology, Infectious Disease faculty of the OU Health Sciences Center, which means it's the most current, latest evidence-based information about stopping the spread of COVID-19. As this information quickly evolves, we will be updating this campaign. So if you are interested in using the materials, it's a marketing toolkit that includes talking points, prevention flyers, advertising, posters, social media assets, all types of things that you can implement even in your business if you want to share that with your employees. There's also public service announcements for radio and television in it. You can email us feedback@oumedicine.com, and we will share what marketing people call native artwork with you. At this point, we are actually going to open the floor for questions. So we're going to we have a Facebook Live audience that is going to be asking questions. So we'll have some things coming in from Facebook Live, and we do have some of our experts that have still remained here for questions. So if you maybe want to come socially distanced, kind of to the sides, maybe a little more readily available to answer questions, I'd sure appreciate that. I see we already have one hand raised around a question. What's your question?
Hi, this is Christine over at Channel 5. You guys mentioned earlier that you guys were possibly trying to develop some sort of vaccine. I think that was Jason Sanders who mentioned something about that. Do you mind elaborating on that a little bit?
So yes, I'm going to actually ask Dr. Sanders to come over and speak in the mic. The question is around the vaccine that he had mentioned developing.
So one of our roles as an academic health center is to bring research from the laboratory to patients. So there are two announcements. One of our researchers is working with a company called MHC to develop a new vaccine. So a researcher here taking our laboratory research, bringing it to the clinical environment. And the second one was, as many academic health centers are across the country, and you've seen on the national news, bringing a vaccine that was developed elsewhere into our clinical environment. You've seen that in other diseases with our Stevenson Cancer Center. It's exactly the same people, resources that we have here to bring vaccines for COVID-19. The only caveat I would say for our listeners is we have great hope in vaccines. There will be a vaccine for COVID-19. The question is when. But I really want to underscore what all of our experts have said at this point, and particularly what Dr. Bratzler said. I think the 1918 pandemic slide, hopefully one that everyone saw, we really need to act now in stopping the spread. We want to reassure the audience that as we're doing that and we're looking at the long run and preventing this in the future, we'll fully participate in vaccine development.
This is Charlie Gray with Fox 25. You also mentioned that there will be free clinics. Where will those be located, or are you able to say where they will be located? And that's for Jason Sanders.
So the question was about clinics and clinic locations.
So I can start. We're working with the state health department, Oklahoma City County Health Department. As Dr. Drevitz discussed, we're at a phase now of distinguishing screening and testing. And so in general, the approach would underscore if you have symptoms, and particularly if they're mild, or if you don't have an elevated risk by age or by associated conditions, we are recommending to isolate yourself. And as you heard yesterday from national experts, not only isolate yourself, but as much as possible, isolate your family. We are nationally and locally working with partners to try to increase testing as rapidly as possible. You saw the curve that Dr. Bratzler showed earlier, that rise of infections, and we want to get more information to see where we are on that curve and to see if what we're implementing to distance people is working. So right now, that's the way we're looking at it. We are also providing care for other patients, whether flu or other conditions in our clinics. In particular, as we're trying to stop the spread, as we're delivering care, we're asking patients who have symptoms suspicious for COVID-19 to not come into our clinics, to not come into our emergency rooms or hospitals unless those symptoms are severe or they have risk. We, on a daily basis, will be working with the state to announce screening facilities for our own patients here and for the community. That is under development. We don't have an announcement today. But what we can say clearly today is if you have mild disease, the best step is to isolate yourself, stop that spread. Certainly, if you have symptoms, that's why we are here, to provide care. Others may want to elaborate.
I have a couple other questions that are coming in. I have a couple questions coming in from Facebook Live. So one of the questions is, I'm going to bundle it together. It's really, can you have the flu and COVID at the same time? In addition to that, if you've had the pneumonia shot, does this have any impact on a person's reaction to the virus if it compromises the lungs?
So those are both good questions. The best data I can tell you is out of China, and I'll answer the first question first about can you have influenza and COVID at the same time. I could find 2 studies on that, both from China. The first study encompassed only 30 patients and then had 30 controls. In that study, over about 20 to 30% of patients who had COVID also had one form of influenza or another, either influenza A or influenza B. So in that small study, you could see co-infection. Last week, there was just published a larger study of patients with pneumonia caused by COVID. In that study, only 1 out of about 170 individuals who were tested for both influenza and COVID also had influenza A. So my counsel would be, it is possible that you could have both infections at the same time. The big difference is we have drugs that can treat influenza. So you need to know if it's influenza and you can get treated for influenza. If your symptoms go away and they don't come back, you're good. And I can't remember what the second question was.
It's about the pneumonia shot.
Oh, yes. Also a very good question. If you've had a pneumonia shot, how does that change your personal curve, so to speak, for the COVID disease? So if you've had the pneumonia shot and you've had a good response to that vaccine, it will not change your ability to get infected by COVID. And in fact, it probably will not prevent you from getting COVID pneumonia if that's where things were going for you. That said, it may prevent you from getting a secondary infection by the bacteria against which the vaccine works on top of the COVID. So there is some value in making sure that you are up to date in your vaccines. And I'll just put a plug in here. There is also value for stopping smoking. Lung disease is a risk factor for COVID. If you stop smoking now or stop vaping now, you can in fact improve to some degree the host defenses in your lungs fairly rapidly. So always a good time to stop.
I have another question from Facebook Live. Historically, it seems that pandemics seem to die down when the weather gets nice and people go outside. Do we have any idea if that might occur with COVID-19?
We can speculate. One of the reasons why we tend to see the increase in infections, whether it's influenza or other acute respiratory infections, including coronavirus infections during the winter, is because of what we've been talking about with social distancing. People come together for holidays, they're inside, the weather's terrible, and the ventilation isn't great, and that provides opportunities for acute respiratory tract infections to spread among people. During the summer, when the weather's nice, people are outside, there's more social distancing, and it is more difficult to spread those infections outside. One of the things that makes it a little bit more difficult to know exactly what will happen with this virus is what has been said, there's essentially no levels of population immunity, and so because so many more people are susceptible to infection, then there could be underlying transmission during the spring and summer and fall months that we wouldn't see with some of the previous infections.
Yes.
Do you guys know, since you're obviously in touch with the health department, what the current situation is on testing here in Oklahoma? I mean, we're supposed to be getting 500 more tests. Do you know any idea?
So the question is around testing in Oklahoma and our work with the Department of Health.
I don't have a latest update on the available number of tests. We know that we've been told that those tests will be made available quickly. The state health department has done some testing. There's no local testing option, private lab testing in the state currently. We've identified current private labs across the region that we can use in addition to the state. But we are in regular contact with both the county, city county health and with the state health department. I got a call while we were waiting, while we were in the press briefing. So I think it's a very fluid situation. Everybody's trying. I know the state's pushing hard. The providers are working together. So how we can approach this in some level of consistency. I've been regularly in conversation with the other major health system CEOs so we can work together on some collaborative responses.
How important is testing? Obviously, the head of the CDC said yesterday that it's essential.
The question is, how important is testing? Dr. Grevitz?
It's hard to give you the right adjective without sounding trite. It is very important to get testing, that we have the ability to test large numbers of people. What we're doing now in terms of limiting testing is largely because we don't have enough tests. Now, that's not a surprise to anybody in this room, and we hope that much of these guidelines and much of our guidance will evolve and over time. So we're really trying to prioritize testing for the people that we really, and by we I mean the medical community, that we really have to know if they have COVID or if it's influenza or bacterial pneumonia or something else. So what we do in the hospital situation is we try to rule out other diseases and then select out the individuals who we have to urgently know if it's COVID for infection prevention reasons or to do other things. So it's quite important, and I'm not the first one to have made that observation.
Question? Did you want to add something else?
As Dr. Drevitz said, it's our reality. You see the numbers. You can see how many tests are available in other countries. Going back to what we showed earlier, we have to make decisions now in the absence of that data. And with the public awareness campaign, that's why we really hope that those listening and your viewer communities listen to what we're advocating today. We're advocating this in the current situation with the best information that we have. And we would urge people not to wait for testing, both on the individual circumstance that we discussed earlier, but as Oklahomans, the best thing that we can do now is to stop the spread and to intervene quickly.
Question.
I gather from what everybody's been saying, we're sort of at a tipping point between stopping the spread and making it exponentially worse. What advice would you have for state and local policymakers who are trying to decide whether to keep the businesses open or close businesses or how to limit social distancing?
So the question that has been asked is around reference to the flattening the curve. And what would we say around social distancing and advice around decisions?
Well, I think that they are listening, and I think they can look at places that have intervened early, and what they've done is Dale showed on the slide how early intervention and what activities that they put in place to stop or bend the curves, flatten the curve rather. I know that we've had regular conversations with the state health department, with people in state government outside the health department. I believe there's a lot of activity for solutions. We are eager to see that and stand ready to engage with the state on how we can be a part of that solution.
So are you recommending closures of businesses and restaurants to help promote social distancing?
I'm recommending we look at what's worked.
Another question?
Today's St. Patrick's Day. A lot of people were packed into a restaurant, a bar. That's happening more frequently, and it seems as though people are just taking it into their own hands. As medical experts, what can you tell people who are going into
So the question again is about people wanting to go out to bars and restaurants and being in crowds, and what would our recommendation be around that?
So my recommendation for folks who still want to go into crowded venues would be that they need to think about what the downstream consequences of this is. What would they do if 4 or 5 days after they went into a crowded place, what are they going to do if they come down with fever, chills, and a dry cough? What are they going to do if they are in a high-risk group and they get sick? What are they going to do if they can't go to work for the next 2 weeks after they get sick? So I think, as Americans, we value our freedoms and our personal independence. And in a sense, these things need to be thought through very carefully because we are a free people and we are a free country. And the best advice I could give them is to think through the consequences of your decisions. And we see that every day in people, for example, who decide to start smoking or who decide, I'm not going to take my medicines today for my diabetes and my high blood pressure. That's a bad decision, but we don't, my role is to give advice. And so I would just urge people to think through the consequences, think them through thoroughly. And, my advice would be to follow what folks you trust are doing. And I hope that we have gained your trust, that we are doing what we think needs to be done. You heard about the measures that the OU enterprise is taking to carry on business, but also to limit exposures in the workplace. So I think that's a good place to start.
Thank you, Dr. Drevis. I just wanted to add one other thing is that people are generally very terrible at assessing their own risk. And with regard to this epidemic, we can see that there are 10 reported cases in Oklahoma. So people may be tempted to think that the situation here is not that bad. People need to realize that those numbers reflect essentially 5 to 7 days out of date because the reported cases are just that. They're reported and they're known. They're not the time that they were diagnosed. They're not the time that the transmission was happening. All of that was happening days before. And so people have a tendency to look at the numbers today and think that that's their risk today, but it doesn't reflect what's actually happening in the community right now.
I'd like to add one more comment to that. I think it's important to understand that when you have the news indicating that there's only 10 reported cases and people may be a little bit complacent about that, understand that 80% of people have mild symptoms and children have virtually no symptoms but are carrying the virus and can spread it. So this is a circumstance that piece of news is deceptive. And we need to be aware, particularly in the face of the fact that we have very limited testing capability, that we don't really know how widespread this is right now. And I think we have a social responsibility to each other. No one wants to be the person who goes out to socialize in a crowded area and then potentially be in contact with a high-risk person and transmit that to them and affect their lives. So it's really, really important for us to be socially conscious about this.
I have a couple other questions, and I know our experts are needing to take off very soon. I think one of the questions is it possible for a person to get COVID-19 more than once? That's a Facebook Live question that has come in.
So that's a great question. Is it possible to get COVID-19 more than once? The shorter answer is we don't know. It's a brand new infection. It was first identified probably in December, perhaps earlier than that. And we won't know these answers until folks who have had documented infection, we have time to follow them and see what happens.
So maybe we take one final question in the room. Who has not asked a question yet?
Yeah, what kind of procedures does OU Medicine have in place if a healthcare worker might be exposed to COVID-19, or or show symptoms themselves?
Okay, so So the question is what type of procedures do we have in place if a healthcare worker is exhibiting symptoms of COVID-19?
First, we have the ability to screen whether there's risk. As Dr. Drevitz has talked about earlier, we have a protocol, an algorithm we follow to assess that risk and determine if a test is needed. If a test is needed, we have an isolated testing site that we've identified away from our acute care facilities so the test can be conducted there. And in the event there's an exposure without a confirmed test or need for a test, we do have isolation. If someone's traveled somewhere where there's an at-risk nation or state, we have isolation and quarantine guidelines.
Okay, I have one final question from a reporter in Tulsa. Dr. Sanders, I think this might be one for you. It is asking the question around what are novel targets for a coronavirus vaccine? What does that mean?
So thank you for the question. The role of a vaccine is to provide a vaccine to individuals in the community who haven't been infected to prevent an infection. You've heard earlier that one of our first lines of defense in the body is your body's own immune system. Dr. Drevitz mentioned, for example, that stopping smoking now can help boost that. The vaccines that you're familiar with, childhood vaccines, flu vaccines, are a boost to your body's defenses when a new virus is exposed to the body. So how do you help boost that immunity? You try to have your own immune system recognize parts of that virus as it enters the body and attack it. So that's what a novel target means. It's looking at things on this virus. Think of it as signs on the virus or however it makes the most sense. If you've seen pictures of it, it's very small, so that your body recognizes it and attacks it. We'll share more details going forward about how the vaccines work, but another way to look at the target is not only how you first identify this new virus, how it's different than flu or other viruses that individuals are exposed to, but then how the body responds. And that boost of the immune system is not only recognizing the virus, but the immune system's response. And probably won't go into further details on that, but we've learned a lot. And leaders like Dr. Drevitz, as we've learned from other viruses like HIV and AIDS, and in our studies of cancer, we've really learned all the complexities of the immune system. So it's not just how your immune system recognizes it, but how it responds. So hopefully that helps.
Sorry, one more question. The State Department of Health just put out new numbers. There's now 17 confirmed cases in Oklahoma. That number nearly doubling just within a day. Can we just talk about what we can expect in the next few days from you guys? Is this a surprise to you at all?
So the question is, the State Department of Health just put out that we have 17 confirmed cases in Oklahoma. 17 confirmed cases in Oklahoma, and wanting to know if what we think we could expect with that information.
I'll start, then have our experts comment. We're not surprised. We're prepared for this. As you've heard, that data already lags several days, and the actual number of cases is higher than that because of what we discussed in lack of testing. Others may want to comment.
Sure, I'll start and then let Dr. Wendelboe fill in when I finish. So think about it, our testing, we're looking backwards 5 to 7 days. And what I mean by that, on average, it takes folks around 5 days to get symptoms. And then if it takes 2 more days to get results after they've been tested, if they were tested on day 5 and it's positive, then you're up to day 7. So you're 7 days out from when they actually got infected. And so this is, again, not particularly surprising. It does give us a look at what's happening. Unfortunately, you have to realize that the reported cases were always looking backwards several days, and in this case, perhaps up to a week or more. Dr. Wendelboe?
One additional thought is just that as testing is made more available, we actually hope to diagnose those cases, and if we can do that more quickly, then it'll be a tool to help us track those contacts and stop transmission.
So I know there's a lot of questions around this topic. We thank you all for coming and spending time with us today, and for the questions that came in from the live stream. We may have some of our experts able to stay just a few extra minutes if you had other questions, but I'd ask that you don't come down and crowd the group. So if you can stay where you're at and flag our media team, we'll try to kind of manage that with social distancing in mind. Just a reminder, we had a question about clinic preparedness for smaller clinics and for hospitals. If you go to oumedicine.com/COVID, the protocols and algorithms for care and the policies that we've created as an organization are available for download there. In addition to that, if you'd like to participate in our public health campaign on getting the word out around especially social distancing, you can email us at feedback@oumedicine.com, and we'll actually share all of the information with you to do that. So thank you all. This concludes our media briefing. If you have additional questions, we may be able to stay and answer a few. Just stay in place and flag us. Thank you.